morning. You guys, one of the biggest programs that the March of Dimes supports is 39 weeks, trying to keep babies inside. Full gestation is 40 weeks for at least 39 weeks. Dr. Emily Minderman is with us now. And Emily, I know you see those patients of yours who are at 37 weeks and they're just done. They want to get that baby out. Why is it important to go at least 39?
Yeah, this has been a tremendous initiative in prevention of what we call late preterm births. And it's an area where things have changed a lot even in the last 10 years of practice. I think at 37, 38 weeks, women are feeling like they're done. They're uncomfortable, their back hurts, their pelvis hurts, and they come in talking about that. And the important thing we have to talk about is the fact that their babies aren't done. There's still an important critical amount of brain development happening. Respiratory function is maturing. And prior to 39 weeks, those babies have a greater risk of even infant death, a greater risk of long-term health morbidities, a greater risk of NICU stay in the hospital. And so we really are encouraging people to hang in there, and for any elective births, wait until at least the 39-week gestational age.
The World Health Organization says that prematurity is the #1 cause of death between babies between the ages of 0 and 5 years old. You're doing a lot to try to educate women on keeping babies inside of them. What are some steps we can take to, I know sometimes prematurity, it's not your choice, but what are some steps you can take to make sure you go full time?
Yeah, absolutely. So you're correct. A lot of preterm births remain unpredictable.
Right.
However, there are a number of steps that women can take to improve the health of their babies and to reduce their chances of preterm birth. Some pregnancies will have risk factors for prematurity, and those might include a previous preterm birth or a previous history of cervical incompetence. They might include other medical illnesses of the mother, hypertension, diabetes, multiple gestations, twins. All of these things can be recognized and identified during the course of prenatal visits, and we can monitor growth of the baby, surveillance of that. All of these things, if we can impact the health of the mother, the health of the baby during the course of prenatal care, reduce their risks of either a spontaneous or an indicated preterm birth, then in the long term, both the baby and the mom are going to benefit.
Okay, so basically the thing you would say is see your physician, see your healthcare provider as the #1 sort of way to fight preterm birth, but then also vitamins and things like that are also important.
Right, so vitamins and nutritional support are extremely important. Folic acid, we hear a lot about that. Folic acid, even prior to the pregnancy, taking that prenatal vitamin before you start thinking about trying to conceive, we know that reduces the risk of preterm birth. And adequate nutrition for the mother is important. Inadequate weight gain, inadequate nutrition are risk factors for growth restriction of the baby, for preterm birth itself. So taking the vitamins, making sure you talk to your doctor about what your recommended amount of weight gain during the pregnancy will be.
Okay, that's some very good advice for the moms out there who think they're done with their pregnancy but need to hold on just a few more weeks. Thank you, Dr. Minderman, so much for joining us.
My pleasure.
March for Babies starts at 10 o'clock this morning. You still have time to get down here. You can do the short walk or the long walk. We're going to talk to one more family impacted by March of Dimes coming up. I'm Carey Wickersham, Fox 4 News, working for you live from Power and Light District.